Assalamualaikum. My name is Muhammad Hazim bin Abdul Hadi, student of Faculty of Technology and Applied Science, Semester 2, Year 1. I'll be presenting public awareness and perceptions of autism spectrum disorder in Malaysian communities, specifically targeted in Seremban, under subject NBHS 1703 for my research. Right, for introduction, ASD or Autism Spectrum Disorder is widely acknowledged as a critical global health and social concern due to its escalating prevalence and the complex problem it poses to individuals, families, and communities. ASD is defined by challenges in communication, social interaction, and the presence of restricted or repetitive activities. These symptoms generally emerge in early childhood and endure throughout life, impacting daily functioning to varied extents, according to American Psychiatric Association 2013. This study seeks to investigate the awareness, knowledge, and attitude regarding ASD among the general populace in Seremban. The research aims to uncover gaps and misconceptions to enhance future outreach tactics and mitigate the social stigma frequently linked to autism in Malaysia society. Next, we go to research background. In the last 20 years, the worldwide incidence of ASD had significantly risen. In 2023, CDC estimated that around 1 in 36 children was diagnosed with ASD, indicating an increasing necessity for early intervention and public awareness, according to CDC 2023. In Malaysia, awareness and public understanding of ASD remain constrained, despite initiative from governmental or non-governmental organizations. The National Autism Society of Malaysia, NASOM, estimates that around 900 children are born with autism spectrum disorder annually. Certain members of community persist in linking ASD to inadequate parenting, supernatural beliefs, and generalized intellectual disability, according to Khairul Azhar 2018. Such misconceptions frequently postpone diagnosis and obstruct access to helpful interventions. As the problem statement, ASD is a chronic neurodevelopmental disease necessitating early identification, intervention, and ongoing societal support. Nonetheless, despite its increasing global and national incidence, the persistence of deficiency in awareness and comprehension of ASD among the general populace, especially in developing nations like Malaysia. According to WHO 2021, underscores that public awareness is crucial for mitigating stigma and enhancing health outcomes for individuals with ASD. In Malaysia, despite the efforts of government organizations and NGOs like the Ministry of Health and the National Autism Society of Malaysia to launch awareness campaigns, substantially deficiencies in public understanding and perception remain. Presently, there is insufficient evidence concerning ASD awareness within community contexts, especially in smaller cities or urban municipalities such as Seremban. The deficiency in empirical evidence constrains policymakers and public health educators from customizing interventions to meet community requirements. If beliefs remain uncorrected, persons with ASD might persistently encounter stigma, and families may be deterred from pursuing early diagnosis and assistance. This study seeks to address the deficiency by evaluating the awareness, understanding, and social perception of autism spectrum disorder within the general population of Seremban, Malaysia. The findings will elucidate the community's perception of ASD and guide the formulation of more effective public education methods to cultivate the inclusive and supportive environment for those on the autism spectrum disorder. So our aims and objectives is to assess the general public's awareness of ASD, encompassing their comprehension of prevalent symptoms, etiologies, and diagnostic procedures. As for justification, the timely identification of ASD frequently relies on public awareness. When public can recognize indicators, children are more prone to receive prompt intervention referrals, according to Lord et al. 2018. Second one, to discern prevalent misconceptions and stigmatizing ideas of ASD among community members. Justification is to misconceptions and adverse stereotypes impede social acceptability and frequent result in the isolation of individuals with ASD, according to Mark and Kwok 2010. Recognizing this belief is essential for addressing them via education. The third one is to investigate the impact of demographic variables, namely age, gender, education level, and occupation, on the decrease of awareness and perception of ASD. As for the justification is awareness is not evenly distributed across populations. Understanding which groups are more or less informed can help tailor future outreach programs to specific demographic needs, according to Rahba et al. 2011. To present evidence-based recommendation for community outreach, education programs, and advocacy initiatives designed to enhance public comprehension and inclusivity for individuals with ASD. As for its justification, to justify the findings of this study can assist local authorities, NGOs, and educational institutions in formulating informed campaigns to enhance inclusion and mitigate stigma. As my research hypothesis for null hypothesis, no statistically significant correlation exists between demographic parameters including age, gender, education level or occupation, and the awareness, understanding or perception of autism spectrum disorder among the general populace in Seremban. Next, we go to the alternative hypothesis. A statistically significant correlation exists between demographic characteristics including age, gender, education level, and occupation, and the awareness and understanding of perception of ASD among the general populace in Seremban. As for literature review, ASD has garnered heightened global attention in the last 20 years due to its rising prevalence and effects on personal development, education, and social integration. According to WHO 2021 reports that roughly 1 in 1,100 children globally are diagnosed with ASD. However, prevalence rates differ by country. The NISOM predicts that around 9,000 children are born annually with ASD, underscoring the critical necessity for public awareness and early interventions efforts. Multiple studies have highlighted the significance of public comprehension in facilitating early detection and diminishing stigma. According to Lord et al. 2018, assert that early intervention is significantly associated with enhanced outcomes for children with ASD. Yet, diagnostic delays frequently arise due to misinterpretation or dismissal of early indications. In emerging nations such as Malaysia, this issue exacerbated by cultural and social impediments. Sohaili and Siti Syuhada 2017 discovered that numerous Malaysians continue to link ASD with supernatural origins, inadequate parenting, or mental disorders. This fallacies results in fear, rejection, and marginalization of individuals with ASD, especially in communities with restricted access to accurate information. Research among healthcare professionals and educators has revealed a widespread deficiency in comprehensive understanding of ASD, especially among individuals anticipated to be primary identifiers of developmental abnormalities. A study conducted by Moll et al. 2010 on Malaysian medical graduates indicated that majority of participants had insufficient exposure to autism-related material during their academic education. Kumar et al. 2015 and Rahba et al. 2011 corroborate this concern, revealing analogous deficiencies among medical students and general practitioners in India and Pakistan. These findings indicate that public knowledge, often inferior to expert knowledge, may be further constrained and influenced by misinformation or stigma. In Malaysia setting, the research on society perceptions is limited, although numerous studies have assessed the awareness of autism spectrum disorder among parents, educators, or healthcare trainees. For research, few research has concentrated on the general populace. Majin et al. 2017 examined teachers' knowledge in Sabah and discovered that while awareness were there, comprehension of clinical symptoms or intervention options was inadequate. Khairul Azhar 2018 observes that numerous families persist in hiding their children's condition owing to apprehension of society disgrace, underscoring the cultural stigma associated with developmental disabilities. As for my research methodology design, my study design is to utilize a cross-sectional descriptive research approach to evaluate the awareness, understanding, and views of autism spectrum disorder within this general populace of Seremban, Malaysia. A cross-sectional approach is suitable as it facilitates data collection and singular moment, offering a picture of the community's current understanding. Study population and sampling. The target audience comprises persons aged 18 and older living in Seremban, Negeri Sembilan, irrespective of their educational or occupational status. This convenient sample method will be employed to recruit participants from public venues, including shopping malls, parks, community centers, and other online platforms such as WhatsApp, Facebook, and Telegram. This study will recruit total 50 participants. This sample size is deemed sufficient for an exploratory public awareness study within the local community, given time and resource limitations. Instrument and data collection. Data will be gathered with a standardized questionnaire built from previously validated instruments and pertinent literature. The questionnaire will be disseminated through Google Forms and hard copies for respondents lacking digital access. Participation is voluntary and responses will remain anonymous. Instrument and data collection. The survey will be segmented into 4 sections. As for demographic, it consists of age, gender, educational attainment, profession, and prior exposure to ASD. And the second one is understanding of ASD, inquiries into symptoms, etiology, and diagnosis. Perceptions and attitude, like skill items evaluating societal views, misconceptions, and stigma. And the fourth one is source of information to ascertain the avenues via which participants acquire knowledge on ASD. Data analysis is quantitative data will be evaluated through descriptive statistics, including frequency, percentage, mean, and standard deviation to summarize the demographic information and responses of the participants. Should it be practicable in inferential statistics? As example, chi-square test will be performed utilizing SPSS to analyze the correlations between demographic variables and degrees of awareness or attitudes. As for ethical consideration, ethical norms include voluntary participation, informed consent, confidentiality, and anonymity shall be rigorously upheld. Participants will be apprised of the study's purpose and may withdraw at any moment without repercussions. The collected data will be securely stored and utilized exclusively for academic purposes. Expected significant contribution to new knowledge and applied value of the outcome is this study aims to enhance the existing research on ASD by offering localized insights to the understanding and perceptions of the general people in Malaysia, particularly in Seremban. Despite the increased focus on ASD in medical and educational research, study society awareness are still scarce, especially in Southeast Asia. This research will elucidate the public's present knowledge and pinpoint persistent misconception within the community, thereby addressing the existing gaps. This research can be significantly resourced for public health stakeholders, community organization, advocacy groups aiming to enhance awareness and diminish stigma associated with autism. These findings may endorse the incorporation of autism awareness modules into community education initiative, local outreach activities, and national health promotion plans. These are my references that were included here. So we move on to questions. For question 1, provide a clear justification for why you need to carry out this study. Why this study important, and how can it contribute to patients, society, and institutions? As for question 2, based on your research problem, explain why the situation will pose risks and burdens to staff, patients, or institutions. I will answer for the question 1. As the answer for question 1 is, autism awareness in Malaysia, especially here in Seremban, is still limited. Many people still believe in myths or have misconception about condition. This lack of understanding can delay diagnosis, reduce access to support, and cause individuals with autism to face unnecessary stigma. My study will look at how much the public actually knows about autism and what kind of perception they hold. This is important because it will help us target the right groups with better, more culturally relevant education campaigns for patients. It means earlier diagnosis, better support, or more accepting environment. For society, it means more empathy and inclusivity, and more for institutions, it provides real data to design training, policies, and awareness programs that truly make a difference. As for the question 2's answer, the lack of autism awareness in the community doesn't just affect patients, it also creates challenges for healthcare staff and institutions. For patients, delayed recognition of autism means they miss the critically early intervention period. This can lead to more severe communication, social, behavioral challenges as they grow. For staff, especially in healthcare and education, a lack of public awareness means they often face frustrated parents, late referrals, and more complex cases that require extra time and resources. For institutions, low publicly awareness increasing demand for intensive support services later on, which cause more and strain already limited resources. School may struggle to integrate students with autism, and healthcare facilities may overwhelm with late-stage intervention instead of preventive measures. In short, when awareness is low, the challenges multiply for everyone involved, from the patients and their families to the staff and the system designed to support them. I think that's all from my presentation, and thank you very much.